Okay, we're recording. The second thing is you will all have access to FizzDAP. Eventually, we are setting it up, the last of it tonight. So, just so you guys can plan the fun. So, you guys take a vote real quick. Do you want to start with respiratory or cardiac scenarios?
Respiratory.
All right, sounds good. That's what I had pulled up. Remember to kind of keep notes on what has been done. It'll help you to decide what treatments you want to provide. Okay? All right, starting now. Dispatch information. You're being dispatched to a residence for a female with shortness of breath and chest pain. And go.
BSI seems safe.
I'm taking this off after this one, just so you know. Keep going. Don't look at the form.
How many patients do I have? One?
As of right now, you only know of one patient.
All right.
Is there anything you want to know en route to the call?
En route to the call, tell me, did the patient give you any appearance of the patient, how long this has been going on, participating factors?
Dispatch says that patient reported she has been short of breath for the last couple days, much worse today.
You are now conscious. TNT and our breathing rate light.
You are just now making it on scene. If you approach the patient, you see that she is cyanotic and short of breath. She is trying to speak to you, cannot form words.
Go ahead. What's her respiration rate?
Respiratory rate is 52. And
did you say 52 is in 5-2?
Yes.
Well, holy shit. All right.
What?
Oh, I'm running it through my head. I had to mute myself because I said words I shouldn't say out loud.
Oh, yeah, me too, but y'all are going to have to get used to that.
All right, so 52 breaths a minute, blue and cyanotic. I need to go ahead and have my partner start assisting her ventilations, put an airway in. Whether she accepts it, she's going to accept a OPA?
OPA?
Yeah.
No, not at this time.
All right, put an NPA in.
Okay.
And go ahead and start assisting her back valve. Inflate the reservoir 100%.
Okay.
And somebody else go roll with it now.
All right, let's see. Who do we got? Michael. Anything you want to do?
All right, she's dying on us, so go ahead and ask her family members if they're any around. What is her history?
Okay, she has a history of just got out of the hospital.
I lost signal, so.
Okay. So she got out of the hospital 1 week ago. She spent 1 week in the hospital, just got out for a femur fracture. Other than that, no history.
All right, right away, that rings my bell that she could very well possibly be having a PE.
Okay.
Due to the fact of the history of trauma and femur fracture, that is a high incidence for pulmonary embolism. She is high priority for transport. We need to get her to the hospital. Go ahead and start her IV. Give her some epinephrine.
Okay. We're gonna come back to that. Anybody else have anything? We're in the truck, we're transporting. What do we want to do for this patient?
What's her vital signs now? Checking my first vitals.
Okay. First set of vitals.
Go ahead, and while I'm checking the vitals, partner's going to put her on the monitor.
Okay. Her respiratory rate was 52. It is now 48. Her O2 is 99%. Her heart rate is 143. I'm writing this, guys, as I'm talking to you. I'm filling it out. So, she is. Do you want a blood pressure? I'm gonna throw that one to you.
Yes, please.
Blood pressure is 156/94. Pupils are equal, normal in diameter. And is there anything else you would like?
Did you tell me yeah, you tell me respiration.
Yep. Donald, you got anything to add? Sarah, Cole?
Okay, so what does my EKG say?
Your EKG is in sinus tach at 43.
Sinus tach and what, Ducky? I'm sorry.
At a rate of 143 with premature contractions. Anybody have anything to add? Any treatments?
Since I would like to do a whole lot of things, I can't, so I'm going to probably request an ALS, either backup, meet, rendezvous.
Okay. Dispatch says ALS is en route to you. They are about 15 to 20 minutes out.
All right, so I'm going to go ahead and start transport. Go to the closest facility with my suspected pulmonary embolism. She doesn't have a lot of time.
Your closest facility is 5 minutes out. And is there what would you like to do?
Phone a friend and let somebody help me.
Yes, that's what I am trying to do right now.
Not that I'm saying I can't roll with it, but somebody help me.
Yeah, you guys are working as a team. All
I'm having an anxiety attack on the unit, and I need my partner to step in and help me.
All right. Sarah. I wish they had
Hold up, Sarah. Let me get the kids ready for school in the morning. We're in the bath and getting dinner done. I'm trying to listen. Sorry, y'all.
Okay, you're fine. Quick roll call here. Donald, can you hear? There are no wrong answers now, guys. Just tell me what you would do.
What about putting her on CPAP?
I would not put this patient on CPAP just because is this truly a respiratory based issue? Or is CPAP and all that pressure going to push the blood clot somewhere it doesn't need to be?
Yeah, I don't think it's a respiratory. I think it's a PE.
All right.
What's my current vitals, please?
Your current vitals are respiratory rate 51, heart rate 140, sinus tach on the monitor 97% on high flow O2, and blood pressure is 164 over 102.
All right. What about some nitro?
You want to give nitro?
10-4.
Nitro 0.4?
Yes, ma'am. Sublingual.
You also need aspirin.
Okay, aspirin, how much you want to give?
4, baby. And make sure your line started before you give the nitro.
Okay. What else you guys want to do? You're 2 minutes out from the hospital. They have no
Ready to call report because we're pretty close. Not much I can do in 2 minutes.
Okay. Who wants to call a report? Somebody other than Donna. Jump in there.
Okay, since no volunteers, and you have to forgive me, I can't remember the age and all because I am driving. But we have a female patient complains of shortness of breath for several days. This is, by the way, Acadian Ambulance 414, 2 minutes out from your facility. Female patient has been this way for about 3 days. Progressively worse today. I have her on the monitor. We are assisting her ventilations, non-rebreather, 100% O2. We have started 2 large bore IVs, HEPA-locked, have gave her 0.4 of nitroglycerin, 324 baby aspirin. Her vitals are whatever Ducky said because I can't write them down. I'm driving. She is in sinus tach, I think you said, and we're about 1.5 minutes from your facility. Anything you advise further?
Not at this time. See you when you get here.
10-4.
All right. We're going to stop this there because it's going to take us a minute to go through this. Can everybody hear me?
Yes.
Sarah? Michael? Oh, look, I got little notes. Awesome. Thank you, Michael. All right, so let's start at the beginning. We're sent out on a female patient with chest pain, difficulty breathing. And just in case I missed it, I'm going to ask you guys, at what point did we do a primary survey? Did we ask sample? Did we get any information about this patient's history other than what is their medical history? That's the only question I heard ask. And when did it start?
Did not.
Did not. All right. And I'm not fussing, guys. This is all a chance to remind you to force it into your skulls to do this when you get on scene with these patients. You can't trust your partner to do it. When did we assess her airway and make sure there's nothing in there? When did we ask about mental status? And here's the one that's really sticking in my craw right now, especially after how much we fussed at you guys about it. When did we ask about allergies before we gave any medications? This patient was a pulmonary embolism patient. That was a great catch, Donna. I don't know that I would give her nitro or aspirin, because this is a blood clot. When we start busting up blood clots without being able to be in surgery and suctioning those out, where they're going to go is the direction of the blood flow. The direction of the blood flow goes down into smaller vessels, and that is when the patient codes. Everybody there? Anybody have
Yep.
anything you want to add right now? Cole?
Can you hear me?
Yeah, I can hear you.
No.
All right. I would rather you guys all be jumping in and, working on this stuff. Jump in. Even if the answer isn't exactly what we're looking for, at least it's something. It's saying that you're thinking about what to do for these patients. Feel free to jump in. We're going to call this one a wash, and we're going to start over. Not with the same scenario, because that one was somewhat boring. But jump in there. Let us know what you're thinking. Okay? Oh, and by the way, you had an answer sheet right in front of all. All right. Let's go to the next one. Respiratory or cardiac?
Do another respiratory, please.
Okay. All right. 2 seconds.
All right.
All right. ARES 224. We need you en route priority 1 to the local Walmart, male patient, complaining of difficulty breathing. That's all we got for you. All right, I'm going to turn mine off.
BSI seems safe. And what am I looking at?
All right, you have your BSI. Your scene is as safe as Walmart ever is. You come up on a approximately 35-year-old male. He is sitting on the floor in the produce section. He says, I can't breathe all of a sudden, and he doesn't know why. He looks pale. He's clammy. That's what you see. He looks at you if you walk up, but he's obviously distressed. Shout it out. The patient's suffering.
Okay, I'm gonna go ahead and get my vitals while I'm asking him questions. I need to know his history. I need to know what he's allergic to, what he was doing prior to this event.
All right. Patient's only medical history is hypertension, new onset. His vitals are blood pressure, 98/64, heart rate, 127, respiratory rate is 42. Anything else you would like? Is there any more information y'all would like? Let's see.
Yes, while I'm getting all of his vitals, I also need his history and what he's allergic to and what he's doing for this event.
Okay. So his history is he has a history of hypertension, diagnosed about 2 months ago. He is allergic to papaya and penicillin. What else in his history would you like to know?
Was he possibly like COPD, asthma, anything of that sort?
He had asthma as a kid, but he has not had an attack since he was 5 years old. No history of COPD.
What was he doing before this occurred?
Grocery shopping.
Okay.
Patient looks at you and says, I can't breathe. It's getting worse. Something's wrong. He's starting to turn blue.
Did you try eating anything when he's in the grocery aisle?
He took the normal couple of grapes, but he does that every time.
I'm gonna check his airway. Make sure there's nothing in it.
All right. How are you going to check his airway? Have him stick his tongue out, talk to you, cough. What's our choice tonight?
I mean, I guess as long as he's sitting up, we can just tell him to stick his tongue out and let me look down up in there.
Okay. He sticks his tongue out,
Is there
and
anything in?
you don't see anything in his mouth. You don't see any grapes in his mouth. His eyes are starting to become bloodshot. He says,
He
"I
needs some oxygen, people.
breathe."
He needs some oxygen. Somebody give him some oxygen. He is suffocating in front of your eyes.
Patient is now unresponsive on the floor.
Does he have a pulse?
He does. He does have a pulse, but it's starting to feel a little weak.
All right. Well, we're gonna go ahead and do the head tilt chin lift. I'm gonna try to put in an OPA. Will he accept that?
He does. You have a hard time getting it in place.
All right. Well, I'm gonna keep trying until I get it in place. We're gonna go ahead and do a BVM and start bagging him. I'm gonna have my partner get the stretcher so we can get him ahead and get him loaded up to go.
Okay.
I have a question, Ducky.
Okay.
I know I was going to bow out, but I have a question. So he's in the produce section of Walmart, and you said he was allergic to papayas.
Yes.
He happened to touch some papayas.
Yes. He did. He didn't realize that it was mixed in the same as the lemons, and he was trying to get some lemons.
Awesome. Does he have an
Okay.
epi?
What?
Does he have an EpiPen?
You do not find one on the patient. He is unresponsive. He cannot answer any further questions. It is visual and palpation assessment alone.
Start an IV.
Give him Benadryl.
Get IV access to give epinephrine.
Hey, Cole, lower you a little bit. How much epi do you want?
Again, Ducky.
Half. This epi is in your scope of practice, guys.
$1.25 IV.
Okay. Patient's looking a little more pallid and cyanotic, and you reach down and he has no pulses. What do you want to do?
CPR.
All right. Starting CPR.
Did we give the epi 0.15?
So I asked earlier, are we stretcher loaded transporting at this point? All right, Sarah, Donald, you two are in the back of the truck. Cole is driving. You're on the way to the hospital. You three are the only resources you have.
Who did you say, Ducky?
Sarah and Donald are treating the patient. Cole is driving. Those are your resources.
I would request for a ALS intercept.
All right. You're in a small county. The train is blocking them. It's going to be they are out of town, the train is blocking them. It is going to be 45 minutes before they can get to your location. The nearest hospital, you can see the parking lot from where you're sitting.
Rapid fuel to the hospital since we're right there.
All right, anything you want to do on the way?
Yeah,
People preferably.
Well, considering you're doing CPR, I think we should think along other means of what we might want to do.
well, you also want to know the hospital of what's going on, do a patient report with them to let them know.
You're tuning in. This is You Break Week 6 ER. Go ahead with your report.
Shit, I'm eating, so.
Well, that's okay. Spit it out and give them your report.
Sarah, help me out on this one.
Well, crap, I'm not going kids. Hold up.
Hold
We're
on.
on the way with a 5-year-old male that went into cardiac arrest.
All right, go ahead.
Calling the radio report to the hospital. En route to you with a 35-year-old male that went into cardiac arrest. He had a history of allergies to papayas, and he touched one of them. And hold on. Emery, I need you in the bath. What are you doing? Hold up.
All right, Donald, take over for your partner.
All right, so I missed the age. Male patient, cyanotic. Went down to full arrest, start CPR. I don't know if it searched anything. I don't know if any patient history. ETA, 2 minutes.
All right, you're pulling into the bay. Doctor meets you at the back of the ambulance, and we're going to stop there with this one. I'm going to let you guys review yourselves. Donna, you're unmuted.
Okay, first and foremost, we're asking for participation and kind of sat around and watched the guy go into cardiac arrest because we didn't give him any oxygen or assist his ventilation right off or catch on that he was in the produce section and he was definitely allergic to papayas and dying before us when probably some epinephrine would have stopped his allergic reaction.
Okay. How far in did the information that he's allergic to papaya come to you guys? How far in did
Right in your initial.
produce section come to you guys?
When you told us where he was at, when you gave us the information that he was in the Walmart produce section, having trouble breathing.
So in the dispatch information, pretty much?
That's where I heard it.
Okay. Like I said, we're not really teaching skills right now. We're teaching critical thinking because that's what you need to perform the skills, to know when. It's knowing when is just as important as knowing how. So the first big thing was nobody thought, we're in the produce section. He's allergic to papaya. We might want to look a little closer here. Hold on. I kept really getting notes on this one. Cole, I like when you asked about did he eat anything. That was really good.
I'm trying to figure out if I'm muted. I don't think I'm muted, right?
No, you're talking now. You're good. If you have the green box, you are talking. If you hit red, you're not.
For some reason, this keeps randomly muting me.
Oh no, that would be me when the noise starts coming through, like the heavy breathing noise, just because we can't hear it all. Yeah, sorry. Yeah, unmute when you talk and then mute when you're not. That way everybody can hear. Mine automatically does it as soon as I start talking. So that's why I say you may hear some not so nice words. Y'all gonna have to ignore it.
Pretty sure we're all used to that.
Good, good. But I did like when you asked about if he's eating anything. Who amongst us hasn't had a grape or two in the produce section? At 1833, he went unresponsive. We started the scenario at, I believe it was 1826. We're going to go with 1826. At 1837 is when he got epi. So that's 4 minutes that he was down without any epi. And when he did get epi, he got 1.25 milligrams. So let's look. If you guys can see this paper, I want you to look at the critical fail criteria. As in, this is your national registry test, and if this were, what would get you? So if you look, sick or not sick is a critical fail criteria. Appropriately managing airway, breathing, treatment of shock. Critical fail criteria. What is automatically going to get you? What is anaphylaxis? It's a form of shock. And I know this is the first time for a lot of you guys, so I'm not fussing, I am reminding. Does anybody have anything to add?
It was pretty much an epic fail.
Right, but I'd rather you fail doing this than fail on the actual test or fail with a actual patient. So it's not a failure if you learn from it. Did anybody learn anything?
Yeah.
Donna, I'm afraid of what words you might use, so hold on there. Perhaps.
Just said yes.
Oh, well, I'm very proud of you. Yeah, if you guys watched the video from the last class, that is why I said it. So when you're on the truck, real life on the truck with your partners transporting patients, be watching this stuff. Be looking, are they sick, not sick? Just start with that. Look at the patient, are they sick, not sick? And you don't have to say it out loud, say it in your mind. Keep a mental Rolodex. All right. So everybody feel pretty good about being done with that one? Okay, let's go to a cardiac one. You ready? I have to get a new paper because mine's full. Hold on. Okay. Yes, I found my pink pen. You guys all ready? Yeah? All right. ARES 214. 214, I need you priority 1 en route to a 72-year-old female patient complaining of chest pain. We are still getting further information for you. And go.
10-4-2-14 will be en route. Dispatch is patient conscious or unconscious, alert or responsive.
This is going to be a medical alarm. We're still trying to get that information.
10-4 en route. Let me know when I'm on.
Medical alarm company is saying patient called in, complained of chest pain. You're in the background. Just not talking to the phone anymore. She does sound like she's moving around. All right, you are on scene at a one-story single-family residence. No obvious hazards. You approach the building.
All right, I'm knocking on the door. Hey, Miss Smith, this is Donna with ARES, Unit 214. Can we come in?
Yeah, come in. I'm right in here.
All right, gained entry, first impression, patient's mental status. She is talking to me. Seems alert and oriented. Does she appear to be in any distress?
She is sitting in a recliner, holding her chest, breathing heavily, and looks up at you. She is diaphoretic and says, I don't feel good anymore.
Her chief complaint is going to be chest pain, shortness of breath. Miss Smith, you just say that your chest is hurting and you don't feel well and you're having trouble breathing. Is that correct?
Well, my chest hurts and I don't feel good. My breathing, it's okay. It just hurts in my chest.
Are you allergic to any medicine?
Well, yeah. Yeah, I'm allergic to that penicillin stuff. Made out, guys.
Do you take any medication?
Oh, yeah. The doctor's got me on Benadryl and that metformin. It really tears my stomach up. And he put me on that new medicine 2 weeks ago for my heart.
All right. Do you have any cardiac problems, any heart problems? And you're diabetic, correct?
Yeah, I have that high blood pressure and I'm diabetic and my heart has that funny rhythm.
Okay. All right, so can you go ahead and get baseline vitals for me?
Absolutely. What vitals would you like?
I'm going to go ahead and, while my partner is getting my monitor set up, I'm going to go ahead and start her on some oxygen. Going to start her off on, tell me your respiration.
Her respiratory rate is about 14 and deep.
Start her off on just a regular non-rebreather, 12 liters a minute. All right, go ahead and give me her vitals now. I'm going to hook her up to the monitor and do a 12 lead while I am getting ready to take her blood pressure, blood sugar, pulse ox, respirations.
Her blood pressure is 18/64. Can you do me a favor? When you're not talking, can you mute? Thank you, darling. Blood sugar is 193. O2 is 98%. Is there anything else you would like? Oh, I'm sorry. You want to hook her up to the monitor. You hook her up to the monitor. Her heart rate is 58. Oh, wait, no, it's 62. No, wait, it's 59. When you get the 12 lead, you see elevation in 2-3 in AVL with depression in 3, 4, 5, and 6.
Okay, Miss Smith, are you allergic to aspirin?
No, doctor told me a while back I probably shouldn't take it though.
And why was that?
Well, it's after he put me on that new medicine for my heart rhythm.
All right. Are you prescribed any nitroglycerin? That's the stuff sometimes you put under your tongue, gives you a bad headache.
Oh, yeah, I had it before, but I don't have any here at the house.
Okay. Blood pressure's too low for nitro right now. We're not going to give that. This patient is sick, unstable cardiac arrhythmia, possibly having a MI due to her 12 lead reading. I'm going to go ahead and get her in the unit.
I can't hear you. I missed what you said.
All right, I said I'm not going to give her nitro due to her blood pressure. Her diastole is too low. I do have her on oxygen, non-rebreather. I'm going to go ahead and load her in the unit. Request ALS intercept. I fear she may be having an MI.
Oh no, Donna.
Yeah.
You hit your head. You're unresponsive. Your partner's gonna have to take over patient care.
Oh hell! Forgot to take my diabetes medicine. I just wanted DKA. Sorry guys. Bye.
Donna, ask your partner to take over patient care.
Okay. Let me see. Hey Cole. I am feeling really bad. I'm gonna have to go outside and draw some cookies. Can you take over for me real quick?
Yeah, I missed a good part of that.
Okay, so we're loaded in the truck going to the hospital. She cannot have aspirin because her doctor told her not to take it. She cannot have nitro because of her low blood pressure. Donna, fill him in on what you got. Well, you know what? I'm gonna play Donna for a minute. O2 98%, respiratory 14 and deep, blood pressure 118/64, heart blood sugar 193, heart rate's irregular. She has elevation in 2-3 AVF on the monitor, and depression in leads 4, 5, 6, 3, 4, 5, 6. And you are caught up, my dear.
Does she have any history?
High blood pressure, diabetes, and that funny heart rhythm.
How long has it been going on?
She said she started feeling bad last night right before bed, but then today it's just so much worse. She feels like she's gonna throw up on you.
Is she allergic to anything?
She is allergic to. Hold on, I wrote it here.
Penicillin.
Yes, penicillin. And allergic to penicillin and morphine.
And now she's nauseous?
Yes.
What'd she look like?
Well, she's kind of adorable. Got cute little gray curls. Not very big, probably about 120 pounds. Quit wearing ruby red lipsticks in the 70s. Her skin is, she's clammy and she's pale, ashen pale.
Are we already en route?
Yes, we are en route to the hospital. We're about 10 minutes out.
How old is the patient?
She is 72.
So no aspirin, no nitro, rapid transport. Well, she's not really all that critical.
All right.
How far am I away from the hospital?
10 minutes.
She's having trouble breathing. Put her on O2, 4 liters, nasal cannula.
I've already got her on O2, non-rebreather, 14 per minute because she has short of breath.
Okay.
All right, you ready to call in report?
Yeah, we can go ahead and call them.
All right, you
No,
kill.
I want to do more for her.
Huh?
I want to do more for her.
Donna, how hard did you hit your head?
Very, but I don't want her to die. I can do more for her. But I won't. Go ahead. I'm out.
Oh, you said you can
That
do
was just that was the delirium in me talking. Sorry.
I couldn't figure out what you were saying.
Continue without me. Leave me at
All right. Cole.
Yep.
Your partner's in the floorboard, in the wheel well. You're calling in report. This is you kill, we say VR. How can we help you?
I have a 72-year-old female complaining of shortness of breath and chest pain. She's already on non-rebreather. What was the rate?
14.
14 liters a minute. Allergic to penicillin. Heart rate was too low to give nitro. Blood pressure was too low to give aspirin. Yeah, blood pressure was too low to give nitro. Recommended against aspirin. That's all I got.
All right. All right. How far out are you? I'll hit you in. You're about 5 minutes out at this point.
Okay, we're 5 minutes out.
All right. All right. Does this patient seem stable? Can she go to triage? We're kind of full right now.
I'd say no, just because of the chest pain and the wonky heart rhythm.
Copy that. We'll try and get your room. Might be a little bit. See you when you get here. All right.
I know I forgot some stuff.
Well, that's why we're learning. That's why we're reviewing. This is why you guys need to try and do classes live as often as possible. Not just you, Cole, just because if you're listening versus actively participating changes the way you learn. But moving on. You are pulling into the ER bay, getting the patient ready to get out of the hospital, out of the ER. I'm sorry, out of the ambulance. Y'all got me all turned around. Your partner, who fell and hit her head and was acting wonky in the floorboard, is now vomiting. Your patient hears your partner vomiting, starts vomiting, and you're calling for assistance to get him out of the truck. Nurse walks out to assist you and screams, "Why the hell did you not tell me you have 2 patients?" Did you forget a patient?
I wasn't even thinking that my partner was that bad off. That's why I guess I missed that part.
It's okay. That was something thrown in. Just keep an eye on things. Your partner's down. You got a firefighter driving you in who's really awesome. It's his 3rd day on the job, so it's okay. I forget things at that point too. Is there anything else any of you would change about the scenario? Change what you had done? Ooh, look at there.
Before I bumped my head, I would have went ahead and got my IVs. I passed out for them.
Oh no, you can talk.
So got my IVs, just kept locked them.
Okay, just a reminder, we don't have to lock.
Sodium lock.
There you go.
I'm going to amend that. She doesn't really have any respiratory as far as fluid, so I'm going to go ahead and bolus her with 250.
I think that's a good call.
And while I was passed out, I dreamt that she said she was having pretty significant nausea. Because I got a good patient hated IV, I would go ahead and give her some Zofran, 0.15 mg per kg.
Is that the adult or pediatric dose?
That is the adult dose. That is for greater than 6.
EMS 4 milligrams.
Yeah, you're right. Sorry, my bad.
No, you're good.
4 milligrams. Yeah, I gave you just 2 doses. 4 milligrams Zofran, IVP.
Okay. Hey, Michael, I know you can't talk out loud. Are you able to type?
I can talk.
Oh, hi.
I just don't want to talk.
I have been giving you a break because I didn't think you were able to talk out loud in these. So it's good to know I was wrong.
I can always talk.
All right. Well, get ready. Do you have anything to add?
Nope, just listening to everybody talk.
He's a man of few words.
Huh?
He is a man of few words.
Well, that's great. That's great. Just not in scenarios.
I teach high school kids all day. I'm kind of tired of talking.
I gotcha. Okay. All right. So, Donna, you were doing really well. A lot of stuff there that was getting thrown at you. Cole, you did really great at stepping in. We need to be watching what's going on. This goes out to Donald and everybody else in there in scenario land. Stay on top of what's happening because you never know when you're gonna have to step in.
And when you step in, you can't ask the patient who may not be able to answer you the scenario that has already been given, started, and 3/4 of the way through.
Yeah. You guys are lucky because the patient was going to, based on real life experiences, knock Donna out with her cane. Because that's what happened on the real call. I was actually the EMT on that call. My patient all of a sudden got her cane up and beat the ever loving crap out of my partner's head before he could do anything. But I like Donna, so driving pool?
No, I got a fan on in the room.
Oh, okay. I thought I heard horns. Okay. All right. Let's take a break for a second. For just a second. If y'all need to use the restroom, get a drink, anything, don't leave while I pull up the next scenario. I bought a printer for work and I'm a little excited. Alrighty. I have got to start investing in chocolate covered peanuts before I get to work because I always start craving them right when I get to work. Okay. Guys, 2 minute. Is this like this? Is there anything that you guys think would make this easier for you guys to do these?
The scenarios?
Yeah.
This is probably the best way for me because once I start picking up on things I'm leaving out, I usually can remember it the next time, hopefully.
Yeah. Does it make a little more sense why I've been harping on you guys to come join the live lectures once you're in here and participating in this kind of stuff?
I mean, once I get it figured out, yeah.
Okay.
I'm wondering why I can't log in on my computer.
Oh, what are you logged in on?
I'm on my phone at the moment.
Okay. Do you have a password username mismatch?
I'm trying to figure that out. 1 second. Let me try and log in again.
Okay. Well, soon, while you're doing that, I'm going to start the next scenario going. And
Okay.
we'll go from there. I'll be able to see once you log in because it'll show you twice on here. So if it comes up, I may be able to help you with that. All right. You guys ready to start? Aries 214. I'm going to need you priority 1 en route to the Lobo Grill for a female possibly choking. And go. Come on, guys, put it out. All right, Aries 214. I am now showing you on scene. Michael, start us off.
Okay, so is the scene safe?
Yes, your scene is safe.
All right, I'm gonna make sure I have my PPE on.
Okay.
I'm gonna go inside. There's just that one patient.
That is all we see.
All right. I'm gonna consider whether I need to call ALS. Does it look like anybody's fallen? Does it look like she's fallen?
You see one.
What is her position? What does she look like?
Yes, there you go. You see one woman laying on the ground, a crowd of people is around her. Somebody's at her head. They seem to be digging in her mouth.
Okay. So.
Not moving. You can see.
Is she flopping around? Is she? I'm gonna go up and check her responsiveness.
She does not respond to you.
Okay, so at this point, I'm going to open her airway. Well, I'm going to check her pulse and check for breathing.
She does have a pulse. It is rapid. You do not feel. How are you checking her breathing?
I am looking at her chest for rise and listening to see if I hear any of her breathing.
You see nor feel neither.
Okay, so I'm gonna. So she's fallen, right? I'm gonna ask my partner to hold C-spine. We're gonna do a jaw thrust and see if anything happens. If nothing happens, I'm gonna go ahead and see if she takes an OPA.
Okay. Yeah, you can get an OPA in there.
Okay. So she's got a pulse. So do I once I do the jaw thrust and I put an OPA, does anything happen?
No changes. She is beginning to become cyanotic.
All right, I'm gonna get the bag mass valve. Well, I'm gonna get the VBM out, and we're gonna start assisting ventilations with 15 liters.
Okay, I get what you're saying.
Okay.
You try to BVM, but she still has no chest rise, no air circulation.
All right, well, I'm gonna see if I can turn her over and slap her back. Well, now I got the OPA in, so now I've screwed up. So I'm assuming that I didn't check to make sure anything was in her. Well, I mean, I did check to see if there's anything in her mouth, but
we always do things that we've choked on. I didn't talk. I'm just pointing that out.
now say again.
Continue. You're good. You're good.
Well, I mean, if she had an obstruction and I didn't see it and I put the OPA in, now maybe she does have an obstruction. So now I'm kind of thinking, if I'm not able to get any, I don't know now.
Okay, so you know what? It's okay though. Sometimes you're gonna mess up on real calls, and you have to keep going and fix what you messed up. So it's okay.
So I can just take the OPA out and I mean, if she's laying on her back,
Right.
then I can't pick her up and do anything. So I'm just gonna have to try to do back, or I guess I could do chest thrust and see if I can dislodge anything that's in there.
Okay.
And then I'm gonna get the suction out. I'm gonna get the suction out. If that doesn't work, I'm gonna get the suction out and see if I can suction her airway.
Okay, so you're gonna do a chest thrust.
Yes.
And if she doesn't, chest thrust, unresponsive, adult female. If that doesn't work, you want to start suctioning.
I will suction and then, I mean, am I able to see anything in there? I do the chest thrust. Do I see anything?
You did some chest thrusts. No, you don't see anything. The patient is a nice deep color of blue.
All right. Well, I mean, if the bag doesn't do anything, I'm kind of, now I need some help. Okay. If I've checked her airway and I can't see anything lodged in there, I've done chest thrust, I've tried an OPA and a BVM, and assisted breathing, and nothing works. Now, I don't know.
Can I add
airway
right there. Let me pause you. Think back to your CPR class. Do we do chest thrust on an unresponsive adult choking victim, or do we go straight to something else?
Maybe she had a pulse.
Did initially, how long is the pulse going to last with absolutely no breathing?
Well, it's not going to last long, but she had a pulse. So I'm not going to start chest compressions. I want to try to clear the airway, but obviously I'm not being able to clear the airway. So yeah, somebody can help me.
Yeah.
Because
the phone a friend.
I mean, I'm not going to start chest compressions.
I got you. So by AHA guidelines, buddy, you're on the right track, and I like what you're thinking about with the pulse. But for AHA guidelines, if a patient is choking and goes unresponsive, we go straight to abdominal thrust. I'm sorry, not abdominal. I'm sorry, chest compressions of CPR. You skip the pulse check, so you won't really know if she's got one. You're just going to go straight to the compressions, and then when you get to your airway, look and see if you can see the object she's choking on.
All right.
We're thinking things through. We're catching on to where we're at.
Was there any history given?
Yes. Did you ask for any history?
I didn't ask for history because she was freaking dying. I haven't even got there yet.
Okay, I understand completely. Life threats, and that is good. Checking your life threats. Cole's your partner right now. Cole's checking on history and reporting back to you. So Cole is asking for history and signs and symptoms. You know, you found her pale and cyanotic. Her family's standing there and they know her pretty well. They tell you she's allergic to penicillin and she's on something called Provocol. They can't remember what she takes it for, but they do know she takes Provocol. Eating dinner when this started with her last oral intake, and that's all you got right now. They're all 1 or 2 in.
And now she's unconscious.
Yes, as of right now, she is unconscious.
Are we continuing CPR?
Michael, are we continuing CPR?
Yeah, at this point, that's all we can do. I mean, that's not all we can do, but yeah, we need to continue CPR.
Yeah, advanced EMT truck. Yeah, that's unfortunately. You started suctioning, and that was good too if you can see the object. So speeding forward, you continue compressions. All of a sudden, the object is moved to where you can see it. You suction it out, and the patient begins to cough and vomit. Keep going, guys.
Do we have any vitals?
So she's breathing. So I'm going to turn her to her left side, and
very good.
And that's the left lateral recumbent position. And
now you're showing off.
And I'm going to then suction out the rest of that stuff and monitor her breathing and pulse and get her the hell out of there.
All right. Cole, you were asking about something. What was that?
I was just seeing if you checked any vitals at this point.
Yes, you do have vitals. Your blood pressure is 100/60, heart rate 88. Respiratory, she's still kind of coughing. It's hard to get a good count, but she is breathing. She's complaining that her throat hurts.
Well, not too much you can do for that. She just had something stuck in it, so.
Right. Okay, yes. Yeah, so you've got her loaded in the ambulance, you're transporting. What do you want to do?
She's stable at this point, right?
It would appear so.
Monitor, call in report.
Call in report, there you go. You break, we fix. Go ahead, 214.
Oh, am I giving a report? I missed a lot of the patient info to begin with.
Michael? Hey, do you go by Michael or Mike?
Michael.
Michael, okay, just making sure. Go ahead.
Oh damn, no, I forgot how old she was.
Well, she's.
I'm transporting a 50-year-old woman. Chief complaint was choking. She was. We performed CPR and chest. We performed chest compressions. patient spontaneously began to breathe after choking up her steak, and pulse and respirations began to stabilize. We are 5 minutes out.
Copy.
And I would tell him the blood pressure, but I can't remember what that was.
That's okay. You've kind of been through a lot right now.
No, that's fine. I'm cool.
All right. ARES 214. Copy. We will see you when you get here. And clear the call. Hey guys. I'm going to make you feel a lot better about it in just a second. But just so you know, all of these scenarios I'm giving you right now are either from real life stuff that is just memorable, but most of them are coming from the first responder handbook. Just throwing that out there. These are all at first responder level with some stuff added in. All right.
So you're just wanting us to take the advanced skills and knowledge and apply it to those calls.
Yep. All the basic stuff is first responder, and then if you're able to do more, add the advanced scope of practice, add that stuff in. Okay? But these aren't like paramedic level scenarios or anything. I'm not throwing anything like that at you.
There'll be a lot of ALS backup.
Well, that's what a lot of them say, but you're going to find that ALS can't get to you sometimes in these scenarios. All right. I don't like that one. All right. Let's see. Hades. Oh, wait. Okay, that is good. You guys ready? Let's see. This will be Donald and Donna. And give me just a second because the printer is printing something out.
Hey, and Ducky, I had to take a bathroom break, so I had to play the job.
Okay, I got you. Well, while that printer is printing, we're going to go get me a drink. I'm at work, so it's going to be a boring drink, but still. Y'all, do you realize I have had 3 showers this shift? It has been that craziness of a day.
Can't say I know what that's like.
Our sweet, innocent, not at all dirty patient earlier turned out to be not so sweet, not so innocent, and very dirty. All right. What time is it? I'm trying to see how many we have time for. Because I do.
7:30.
It's 7:30.
Yeah.
I've got time for 2 more. And so be out of here by 8. So after doing these scenarios, is there anything you guys think you'll be looking at this week or working on more? Hello?
There's a good bit.
Okay. You think you're going to come to the live lectures more for me to torture?
If I can, I'm going to be in places. I'm going to be in Alaska. I don't know if my internet's going to be able to support it.
Nice. Okay, well,
Yeah, and
have to do a class.
I'm going with Cole too, so I'll be in Alaska as well with Cole.
No,
Donna, you can't stand it up there.
Okay, guys. So that Cole doesn't miss out on class, we all have to do a class trip to Alaska. That is
Maybe we can go fishing or something.
nah, darn right. I ain't going up there without going fishing. Ah, yay! I got the good ones now. It just came through.
Donnie would have to learn how to make a fire with 2 twigs.
Huh?
Hey, Donnie
I
would
can
have
do
to
that.
learn. Oh, can you? Okay. I'm sure you know how to put it out.
All right, boys, play nice. Okay, OBGYN or geriatric? Ooh, never mind. I found the one I want. I haven't. Oh, here we go. There may be a few twists thrown at you. That's okay. All right, everybody's belly's full and bladder's empty?
Yeah.
All right. All right. Aries 214. Aries 214. I'm going to need you en route priority 1 to Rock Creek Park for a 72-year-old male who fell into the creek. No other info is available at this time. We're working on getting it for you.
Aries 214, copy en route. Notify changes in transit and tell me what I'm on.
I'm having a really hard time hearing you, but okay. Donald, you be jumping in too, okay? All right. I missed the last part of what you said, Donna.
I said we copy your traffic en route, notify us of any changes or additional information en route, and advise when on.
All right. Dispatch to Aries 214. Be advised, bystanders are stating patient's not acting right. He seems very confused. Let me know when you're
All
on.
right, I'm gonna go ahead and request for law enforcement as well, an additional ALS unit en route.
What about fire?
Fire's lazy. I'm just playing. Nah. Is the patient in the water still, or is he on the bank?
It's unclear. Bystanders said that he fell into the creek, and went about 3 feet down. Floated about 3 feet down. Okay, we checked bystanders. He is on the side of the creek.
Okay. All right. Cool.
Cannot get out.
Wait, he can't get out, or did he get out?
He's laying on the side of the creek. He can't get out of the area.
All right. So we're gonna go ahead and request for fire as well, and specialize the one that does rescue. So we need a rescue truck en route.
Copy. Aries 214 dispatch. We talked to fire. They said they cannot get their unit into that part of the park. They'll see if there's any other units available in the area that can get down there to you. Rescue says they have it covered.
Therefore, appreciate it. Myself, my partner would arrive on scene. Be it a BSI scene safe. Is the scene safe?
Your scene is safe as far as you can see. There's a lot of tree limbs. Careful with your footing there.
Can my partner and I make patient contact?
All right, you can. You can see him, you can climb down to him.
Great. So this is where I need help at. I need you to describe what am I supposed to see? Like what am I supposed to imagine at this point? So I'm looking at the scene. What do I see?
Okay. I'm gonna go slow here just so I can make sure I tell you right. All right. You find the 72-year-old male on the side of the creek about 3 feet down from the pathway over kind of a little cliff.
All right.
He's holding onto some tree roots. He is pale, wet, and shivering uncontrollably. He's breathing rapidly. When you ask if he can climb out, he is too weak and cannot move towards you.
Is it safe for me to go down after him with a scoop stretcher?
Yeah, I believe that's what it's asking you to do.
10-4, we're going to get the scoop stretcher and proceed down to the patient. I'm going to tell Mr. Smith, hey, we're coming down after you. He verbalizes his response and tells us it's okay. So me and Donald have made it down to that patient, and I'm going to say, hey, Mr. Smith, this is Donna and my partner Donald with ARES Med. We're here to help you. Can you tell me what happened?
After breakfast, I went for a walk, and then about an hour ago, I guess I tripped, and I fell down here into the water.
Okay.
Is there any type of
anything?
I'm sorry.
Go ahead, Donna.
Yes. Is he complaining any pain anywhere? Any of his limbs are deformed or anything? Is there any bleeding? Is there any type of trauma?
He says his arms and legs are numb now. When you look at them, they seem to be turning blue, and he is shivering uncontrollably. He doesn't remember if he hit his head, but he fell a pretty good distance and tumbled quite a bit.
Is there any way that we can C-spine him, put a C collar on him? Can we render patient care, or do we need to wait for a rescue?
Well, you climbed down to the patient at this point with this scoop stretcher.
All right.
I'm going to go ahead and take a full C-spine immobilization and lower him after C-spine. Go ahead and lower him onto the scoop stretcher.
Okay.
And at that point, I would say we would not want to render care at that we want to get him into a more safer environment away from the bank or anything like that. So we need to kind of get him more on land before we start doing anything further, such as stripping him down, get him blankets and stuff like that. I would definitely want to, once we got him C-spine and immobilized, let us move him to a safer working area for us.
Okay, that's fair. That's fair.
Okay, while we're doing.
Go ahead.
All right, while we're making our way up the bank, we have the bystanders assist us and carrying him safely up the bank. I'm going to go ahead and continue talking to him. Mr. Smith, do you have any medical problems?
Yeah, I have high blood pressure and shiver. I had a heart attack about 2 years ago. Shiver.
Yeah, so obviously there's probably some signs of hypothermia at this point, so we definitely need to address that immediately.
Okay. It is into February. The temperature outside is 18 degrees. He was wearing sweatpants and a sweatshirt when he started out on his walk.
And all that is so correct.
He fell down in the water, but my point in getting him up out of the creek bed is we don't have a heater, we don't have any blankets, we're down in the creek, and we need to get him up to the ambulance where it is nice and warm. We can't do that down in the creek bed.
Absolutely agreed. With both.
So that's what I'm saying. While we are transporting him up the creek bed on the scoop stretcher, I'm talking and walking to the ambulance where we can get him trauma naked and rewarmed.
Okay. All right. What else you guys got?
All right, so once we got him back in the ambulance, we're going to gradually warm him up safely. I'm going to use my body heat. I'm going to use the IV bag, and I'm going to.
Whoa.
You are not using your body heat. Let's just stop there. No.
Yeah, Donnie, that's a little much. Take his clothes off, put some towels on him.
Phone a friend, Donnie.
Well, not.
Friend.
Well, no, I was going to try to warm up the bag of the IV fluid.
You have.
It should be warm. It's in the back of the truck.
Yeah, never mind. That is true. Yeah, so it should be warm already. Never mind. What?
Okay, he's in the back of the truck. I've got the heater on, 95. I've got him blankets on.
That's too hot for me.
Heat pack. I've got the heat packs on him. Are you allergic to any medicine, Mr. Smith?
Not that I can think of. Shiver, 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 shiver.
Hey, does he have a medical bracelet on him?
Hold on.
Are you trying to rob this man?
It's a medical bracelet. It has no value, Cole. None.
There's some of them made of sterling silver, dude.
Oh, for real? Well,
Yeah.
I just got my $50.
First he
I'm
tried.
joking. Anybody? I would never steal from nobody.
First he's trying to be the big spoon. Now he's trying to steal.
Yeah, it's a big spoon.
I was like using an IV bag, trying to warm it up.
Okay.
Not the patient.
No, he does not have a medical alert bracelet. Come see me after class.
Keep
going.
Okay, I'm going to go ahead and get, can you give me some vital signs? And I want to know his blood sugar as well right off.
All right, vital signs. His blood pressure is 130/60, heart rate 64, respiratory rate 26. His skin is, well, his extremities are a little blue. Very cold to the touch, wet. Pupils are very slow to react. Temperature is 95. And his blood sugar, they weren't able to get a blood sugar, but we're better and we could, so we're going to go with 113.
What was his O2 rate?
94.
That's not bad. His temperature is not bad.
The temperature's 95. You go in hypothermic shock at 93, so you might want to still try and get him as warmed up.
Yeah. No, I agree with you, Cole, but I mean, my normal body temp runs like 95.7. So, I mean, at that.
How accurately is the thermometer you've been using?
On this patient, guys, I don't feel so good. I'm really, where am I?
Well, at this point, we probably should do a focus exam and examine from head to toe. Start with his head. Is there any bleeding in the scalp or anything?
He has a small little skin tear above his left ear.
Okay.
His face is very pale. He's no longer following you with his eyes.
Donna?
Yes.
I don't know. Like,
He might have a brain bleed.
possibly. Is the LS unit here, or are we still waiting on them?
You can hear them. They're getting close. Your rescue crew pulled up right as you guys got to the top of the embankment. Said, hey guys, I see you don't need us, and took off.
That sounds like Poplarville.
Guys, remember that everybody that is at work right now that can log in and watch this.
Well, we're in the back of the ambulance, so like I'm.
All right. So what do you think's going on with this patient so far? Let's get some.
I think he is in pure hypothermia.
All right. Anybody have anything else?
That is the.
I feel like he's in some type of shock, but I just don't know. I don't know this one.
All right. Cole, Mike.
I think he's in hypothermia, but I think he might have. There might be an underlying reason of why he fell down the cliff. But when I'm trying to.
I mean, are you still able to do like a stroke assessment or anything like that?
Who are you? Why are you touching me? I don't feel good. Shiver, shiver, shiver.
So he's just confused. Yeah, I mean, at this point, it's just hypothermia. So I mean, how quickly can you get him warmed up?
Well,
if y'all would have let me lay with him, it would have been quicker. Okay, I mean, Jesus, I gotta improvise. I'm just playing. No, maybe I don't know. I guess I'm going with everybody else. I guess hypothermia.
all right, Michael, you got anything?
No, just get him to the hospital.
All right. Okay, so now that you've got your differential, I think everybody kind of said hypothermia. What do you want to do? You're in the truck. You started warming without Donald's body heat. You've got a bag of IV fluids hanging there that apparently Donald used his body to warm. And that's kind of where we're at with this. Shiver, 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 shiver.
Well, I changed it to the heat inside the ambulance that warmed it up.
Did you take his clothes off?
No, he's still wearing his soaking wet clothes that are also covered in.
No, he's not.
No, Donna said trauma naked.
I said a while ago, I took him trauma naked and I packed him in the heat packs on the ambulance and a blanket.
Okay.
Yeah, she did say that.
She did. While Donald is being arrested for big spooning the patient, Donna took care of it. Hold on, I'm writing down. All right. What else we got,
So
guys?
I'm going to go ahead and start the IV since Donald so graciously warmed the bag for me. Start an IV with the warmed IV fluids that could possibly bring his body temperature up. I'm going to go ahead and start some oxygen on him due to his confusion. The oxygen cannot hurt. I'm just going to put a nasal cannula 3 liters per minute. And then I'm going to go ahead and do my secondary assessment, make sure I don't find any, deformities, contusions, bruises, OPQRS, DCAT, BLS, any broken bones, anything like that.
Your secondary assessment only reveals bruises and abrasions, along with the blood to the trunk. He is.
Okay, I can't hear you, Ducky, because it sounds like there's a jet engine going on.
Okay. All right. Your secondary assessment reveals that the patient has bruises and abrasions on him. He is very lethargic now. His pulse has slowed to 54. Respiratory rate is at 12. He can't move his arms or legs, and he is just kind of looking.
Okay, since his respiration has decreased, I'm going to go ahead and change him over to non-rebreather assisted ventilation, 100% O2. Without him being able to move his arms and legs, because I'm not at the hospital and can't see X-ray vision, he could have a spinal injury because he fell 3 feet, but more than likely it's because the body is shunning all the heat away from the extremities. Once we can get him warmed up, hopefully that will self-correct itself. But can go ahead and assist his ventilation. And I am en route to the hospital, hopefully 99% there.
Okay. All right. Your ALS unit catches up with you right about this time. You guys want, who wants to give a report? You called for ALS, they met up with you. What do you guys have? Why are we here?
Okay, hey, Becky, paramedic partner, found this 72-year-old man. He fell about 3 feet down an embankment into a creek. Found him on the side of the creek. He complained of very, very cold, shivering, skin felt pale, very cold, blue. We had to extricate him out with the scoop stretcher, got him to the unit, got him trauma naked. We're trying to warm him now, have an IV started. His vital signs have decreased and become a little less stable. He is kind of on the sick side. Have him on non-rebreather BVM right now, and he's all yours.
All right. Good job. We're going to call it there. Donald is being bailed out of jail and is back with us to review for the time.
What? I'm done. Thank you, Donna. You're an amazing partner.
Yeah, she pulled strings with her.
Couldn't have done it without you.
Huh?
Couldn't have done it without you. But I couldn't have done it without you, Donald.
Well, you didn't have to. Okay, so big thing. This patient, why is he so sick?
Because of his body temperature and his hypothermia, he can go into cardiac arrest at any moment.
Okay, we could have shoved Donald into the river. Would he have had the same reaction?
Nope.
Probably not, because of his because of the man's advanced age and underlying medical problems. He is more susceptible to hypothermia.
Plus, I'm thick, so I got enough, insulation to last for a little bit longer. So I'll be all right.
Donnie, it sounds like you just want to show off.
Who?
Cool.
So yeah, so elderly patients, they're going to react so much worse to the things that, how do I put this? Not so elderly patients would survive quite a bit easier. Good job with, getting him trauma naked, heat packed up. We do not ever use our body heat to warm a patient unless that patient is our family member and we're camping in the woods.
I didn't mean it like I was going to go cuddle with him. I do like cuddles, but I was not going to cuddle with the patient. I was talking about warming the IV bag up. That's all.
Now, how else would you do that with your body heat?
Cold.
Well, I mean, like I ain't going to go lay next to him. That's weird. Unless he pays me, then that's different.
All right, hush. Cole, you are the patient. Donald is the advanced EMT coming to you. He says, "Hey, Cole, I see you're shivering and cold. I'm going to use my body heat to warm you up."
Come here, big boy. No, I'm just kidding. It's not working. It's not going to happen.
Okay.
If I'm of the right mind, I'd be a little weirded out.
If you weren't of the right mind, a whole lot of other people would be. Okay, so
That's a lawsuit.
the lesson in this is watch how you word things, especially in front of patients. Especially in front of these 34 bystanders who raced over to see what the bright flashy lights were about. Excellent catch on the shunting blood causing, the paralysis. It's not true paralysis, it's just where he's shunting blood.
But we cannot assume that. I mean, that's probably the mechanism we're dealing with is never assuming correct.
Yeah. So you're in a advanced truck. You don't have a fluid warmer. How are you going to warm fluids for these patients?
Stick them in the windshield and turn the defrost on.
Okay.
Pick them up toward at the air vent.
Okay. If you take and you wrap hot packs around your bag of fluid or around your fluid tubing after they've been activated, what's going to happen to all the fluid as it comes through that heat?
Warmed.
Yep. It works really well too, especially if you have the heat going in the back of the truck right on it as well. Think about different things, you can use to make this stuff happen. So this says, to make sure that your EMT considers strokes, head injuries, and environmental causes for reasons for the patient's condition. But y'all rocked it and picked up on the hypothermia really quickly. So, if, I'm going to skip that because that doesn't even make sense. All right, you guys did pretty good, especially with your handoff report. Yeah, this patient, you just have to get him warmed up. Ew. All right, you guys want one more before we call it?
Sure.
Okay. All right, let's see what we got here. Eeny, meeny. Okay, we're going to do this one because it's close enough that all right, since we're going over cardiac respiratory, and as much as I hate it, this is a part of it. No funny business in this. Everybody listen, everybody pay attention. And let's do this. Let's rock this one, okay, guys? ARES 214, ARES 214. I'm going to need you, priority 1, on a 3-month-old. Caller says he doesn't seem like he's breathing. She can't find a pulse. Go ahead.
10-4 unit 214 en route.
Copy. ARES 214. Caller has confirmed no pulses. I can see that you're arriving on scene. Go ahead, Jeff.
Scene safe. I'm going to make sure, all the usual scene safe. CSI, one patient made contact with the parent, and I observed three.
Huh?
What'd you say?
Parent is screaming, grabbing at you, trying to pull you into the house. Hurry, hurry. Something's wrong.
All right, I'm inside. I see the infant, and what's it look like?
Infant is laying on a bed, a normal queen size bed. He is upside down. He's blue, mottled. He has no pulses. And the mother is a 15-year-old teenager saying, hey, help him, he can't breathe.
Okay, I'm going to go ahead and turn the infant over.
All right.
And very gently put him in the sniffing position. Do I get any respirations?
No.
All right, I'm going to check a brachial pulse.
Absent.
Start CPR.
Copy. Donna, the grandmother just ran into the room, has grabbed you, and is screaming, tell me what's going on. Tell me what's going on. You cannot do anything at this point other than console the grandmother.
Okay, Cole, I am disposed. Take this infant and continue CPR and hit the unit.
You're in another room. There you go. All right, boys.
So we're doing CPR right now?
No, you're taking over for Donna, looking at what you've got. So far, you have an infant who is mottled, blue, obvious not breathing. You don't have any further, no pulses, not breathing. You do not have any further information. The mother is in the room.
So start CPR. Try and get the infant to the back of the truck.
Okay.
Is there any medical history with the infant?
Mom says no. He's breastfed, happy baby. He's 3 months old.
Well, once we get him to the truck, can we take vitals?
Yes, you can take vitals.
How long has he been like this?
A little over 15 minutes now.
Oh, man.
Okay, so now we have to decide if we're going to work it or not.
You guys talk amongst yourself. You figure that one out for me. Let me know what you decide.
There's no heart rate?
You cannot find any pulses.
It's an infant, 3 months old. No obvious lividity, I don't think. So just for the sake of a 15-year-old parent, I'm going to continue to work the code, get ALS en route, and put the pedal to the metal, get en route. As I work the code, put a either OPA or NPA in it and bag valve while we're doing CPR.
Okay.
I knocked the grandmother out. I ain't got time for shit. I'm back in the ambulance. Her baby gonna die. She don't leave me alone.
Okay.
So I am in the unit in the back with my partner. We're doing CPR. Basically, all we can do right now is CPR. And I called the fire department. They have arrived on scene, and I'm gonna have one fireman drive the unit as we head towards the ambulance.
Okay. Firefighter says, hey, I'm CPR trained, but I've never driven. I need you to go drive, and I'll help your partner. So,
okay.
Going to drive. Donald, you're a firefighter. Cole and Michael, you are crew members.
Just rotate out CPR until we get to the hospital. How far are we out?
You are about 15 minutes out.
So
Is there
get an
anything
airway.
you
Get an airway. If we can get an OPA or MPA, then BVM 15 liters a minute.
do? Okay.
That's all I got.
All right. So you're BVMing the infant. So tell me, how long have you been down?
15 minutes.
15 minutes. All right. And what happened to the kid before he went down? I'm the medical control that you forgot to call, so I called you. What about his pupils? What do his pupils look like?
What do I see?
They are fixed.
Is there any rhythm?
To his pupils? Not really. I've never seen rhythm in pupils.
No, I mean like on the monitor.
Did you put him on the monitor?
Should have before now.
Yeah, you should have, but you didn't. You want to put him on the monitor now?
Yeah.
All right. He is in asystole.
I guess we have to call it.
Okay.
Did the baby die from SIDS? Is this a SIDS call?
Are you asking in the scenario, or are you asking the dispatcher, or somebody on scene?
I'm asking you as an instructor, but
Oh,
would this be a SIDS call though?
this is a obvious pediatric. Yes.
All right, appreciate it.
If you start working him, can you decide, okay, we're just gonna stop?
No, you have to call med control.
Okay. What are you gonna tell med control that you have?
An infant, however old, went into cardiac arrest 15 minutes prior to arrival. Fixed pupils, asystole on the monitor. 15-minute ETA to the hospital. No improvement. Feel like we should just call it.
Okay. Copy. Understanding that you have been working this child for 15 minutes with no improvement. He was found after being down for 15 minutes, asystole throughout the call. Were there any signs of life upon arrival on scene?
No.
Copy. Time of death, 2012. And we'll alert coroner that you're coming in with obvious deceased. Okay, so we're gonna end that one right there because I want time to not end on that note. We're doing a scenario. Do you guys realize how much stuff that on every other scenario, even the really crappy ones that you got, as soon as I said 3 months old, you kind of skipped a whole lot of stuff. Oh, Donna, you've been released from the driver's seat.
Okay.
You guys are at the hospital cleaning up after the call, debriefing. What you got?
I don't know that we, like you said, we missed a whole lot of stuff. You do have tunnel vision, however, life threats. You have an obvious pulseless apneic patient. Mom rattled off. She found him that way. We had no airway, no breathing, no pulse, no respirations. Top priority is try to save the life.
Right. Is this a life? After he's been down for 15 minutes, he's mottled. No, his pupils are fixed. That can be saved.
Probably not. No, not probably not. Definitely not. But it comes to that. As a parent and a grandparent, you want to see somewhat of an effort, I think.
But also, this is a patient who was found laying in a queen size bed. Had you asked? Mama had just woken up after taking a nap with the baby. Found face down in the bed. A patient that we don't need to be working, we need to let this be investigated. And the current FIDS recommendations are if there are no signs of life and the patient has been down for more than 10 minutes, we don't work them. I think it's under the age of 3 because it's considered a child abuse investigation at that point. Unless they have a medical history of some sort or obvious reason.
And 4.
My 3-month-old patient to check for signs of stroke. So just so you know how crazy crap gets put on these. But so don't want to end on that note. And we're gonna get into pediatrics a little bit down the road. But just things to look for, things you want to watch for with these calls. You guys think you could run a call that is crazy? You're in the river pulling a guy out and then get clear to that call and immediately go to a pediatric code?
Probably not recommended.
I don't recommend it either. You're the only ALS truck in your county, though, so.
Yes, I can. I have to. I'm the only truck in the small town of DeRidder. I have no choice. Yeah. You'll have to critical incident debrief at the end of shift or the earliest convenience. I hate to say that, but sometimes you have to, as they say, suck it up, buttercup, and go on to the next one.
Well, we'll come back to the whole suck it up, buttercup thing, but absolutely. And when you clear this PD code, do you think you might get a patient who calls because they've been nauseous and vomiting for a week? Ask me how I know you will. Ask me how I know. You are not going to want to be nice to the patient who's been nauseous and vomiting for a week. You're not going to want to be nice to the patient's family members of your PD code who are saying, hey, what's going on? Talk to me, and distracting you from the baby. Those ones desperately needed at that point. So just keep an eye on your, honestly, the best way I can put it is your tunnel vision and your own reactions to these calls. Because you're going to have reactions, but that is neither here nor there. All right, so going back to a good one that, oh, I like this. That's not good. Give me just a second, guys. I'm weeding out the stupid ones. The heck? I'm assuming you guys do not want to do an OBGYN.
That's not my forte.
That's okay. We're going to do like 30 of them later. I'm trying to get cardiac ones since that's what we're supposed to be reviewing. Okay, here we go. Okay. Whew, 1 second. I'm talking a lot. My throat's dry. ARES 214, ARES 214. I'm going to need you in route priority 1 to local residents, 42-year-old male, difficulty breathing. And go. ARES 214, ARES 214, second tone, priority 1, 42-year-old male, difficulty breathing. Again, second tone, priority 1, 42-year-old male, difficulty breathing.
Copy dispatch, host and route.
Copy ARES 214. ARES 214, you are 1 minute out from the residence.
Any info before we get there?
Dispatch says the patient's been coughing a lot while trying to call in, and it said this has been going on for about a week.
Say that one more time.
The patient's been feeling not good for about a week and has been coughing a lot.
Okay, when do we get on scene? What do we see?
I'm seeing you find the patient in bed. He is talking normally and states he has had a productive cough for some time now, and it has blood in it. He is coughing up blood, and he just got back into the country after 6 months working in Southeast Asia.
You said he's been like this for a week.
Yes, sir. Oh, I love this one.
Do you have any other symptoms?
Yeah, it hurts to cough, and the cough has gotten worse over the last 2 days.
What's his vitals?
Blood pressure is 120/70, heart rate 98, respiratory rate 14. He is pale, warm, and sweaty. Pupils are equal and reactive. Temperature is 102. Lung sounds, he has striders bilaterally. He is alert and oriented. Oxygen's 97%.
Is he allergic to anything?
No.
Is it safe to transport?
Well, what do you mean?
I mean, can he walk? Can he stand? Is he ambulatory?
He says he can stand, but he's really weak. You may need to help him.
So let's get him loaded on the stretcher and put him in the back of the truck.
Okay. Is this patient sick or not sick?
Do what?
Is this patient sick or not sick?
Yeah, he's sick. I'm thinking it's either like a pneumonia or some kind of infection.
Okay. Do you want any additional resources?
How far from the hospital are we?
You're 10 minutes.
What was his O2 sat?
97%.
He's alert and oriented.
He is.
Does he know how much blood loss he's had?
Just when he coughs.
How long has the blood been coming up when he coughs?
2 days.
I'd probably start an IV, get him on a bag.
All right, you start an IV. And you said you're going to give him a bag of fluid?
Yeah.
Okay, just making sure. What are your differential diagnosis?
Like, what do I think's wrong with him?
Yeah.
It's more than just a flu or a cold. Or it's progressed to more than just a flu or a cold. Probably just pneumonia. Yeah. Well, what is his history of?
Past medical history, no history. He is 42-year-old.
So yeah, he's probably got some kind of infection.
Okay. I think I'd have to agree. You're 5 minutes out from the hospital. Anything you want to do?
Just call, give report.
You're okay.
So he was a 35-year-old male.
He's a 42-year-old male. And
42 years.
yeah. So you kill, we fix. Go ahead with the report.
Oh, a 42-year-old male says he's been coughing for a week. Within the last 2 days, he started coughing up blood. Patient's alert and oriented. Vitals stable except for a 102 fever. Respiratory rate is 14. And what did you say his blood pressure and his heart rate was?
Blood pressure 120/70, heart rate 98.
Blood pressure 120/70, heart rate 98. O2 sat at 97%. IV access established. Have him on normal saline. And we'll be to you in 5 minutes.
Okay. Copy that, 214. We'll have room assignment upon arrival. All right. You've arrived at the hospital and handed over patient care. You're clear of the call.
Was there more I could have done? Was there more I could have done?
Not really.
Yeah, I didn't. I really didn't think so. I was racking my brain.
He needs to be at the hospital. What type of infection would you be concerned about this patient having with his symptoms and his history?
He just left Asia, so I'm going to say COVID.
I'm going to say this scenario was wrote in 2011.
SARS.
What's something else that's been around? Way worse than all that. He's coughing up blood. He's been working in Southeast Asia.
Malaria?
Huh?
TB.
Tuberculosis.
Tuberculosis area.
Yep. There's not really anything you can do without catching it yourself, other than keep him and you both in an N95 transport. He's alert and oriented, so he's not reached the point where he's getting ready to die. Do we have people out today walking around with tuberculosis?
Yeah.
Yep. That's why they keep torturing us with that god-awful test. You did really well with saying this is not just flu or cold. I was impressed.
Well, even with the flu or the cold, like how often you hear somebody, maybe in their later stages of life, would they be so fragile that they're just coughing so much that they start coughing up blood, and he's only 42 years old.
Blood. That's not why. Oh. So yes, you can, especially with things like esophageal varices, that kind of thing. You can cough till you cough up blood, but not the amounts that you would notice externally. This is more, coughing up blood is a telltale sign of tuberculosis. Esophageal varices and tuberculosis. Especially with the high fever.
Yeah, well, that's also the thing. Like if he's running a fever, you know he's got some kind of infection. His body's trying to fight it off.
Yep. So, just side note here because I think it's hilarious. Remember I said this was wrote in 2011. It even has it wrote like 5 times on it. Copy 2011. It said the crew, and this isn't talking about you, it's talking about what you expect your students to do. It says the crew became too complacent, did not mask up, and was infected with tuberculosis. You don't have that problem anymore because we're all wearing masks. Theoretically.
A lot of times.
Huh?
At my company, it's more than just masks. Like we have PAPRs, whole gowns, Tyveks. Like it's above and beyond what any normal company should have.
Yeah, that's good. How often on a 911 call for, well, I guess you would, thinking it was COVID, but would you expect to go on a patient and you would just go inside, and then once you got inside, you realize, oh crap.
Before COVID, probably not, to be honest.
Yeah. I've had a couple, but I knew they were COVID before I got there because we had them listed in our system. Or I knew they were tuberculosis. But I have a feeling I'd be pretty PO'd if I got on scene with nothing on at all and then left with tuberculosis. Like, I don't need a Christmas gift that bad, thank you. I
I
mean,
don't think anybody'd be too happy about it.
huh?
I don't really think anybody'd be too happy about it, no.
Lord, no. Well, I mean, Donnie would be in there big spooning.
Yeah, what happened to Big Spoon?
Where'd you go, Spoons?
I was done, man. I'm just over here just chilling, listening to y'all.
You spooning somebody?
Hey, whoa, don't need to know. Don't need to know. You did good skipping the not important stuff. Is there anything else you guys have to add about these scenarios? I try to keep it cardiac related in one way or another, since that's what we're reviewing. But what are you guys thinking? Helpful, not helpful? Talk to me.
Very helpful.
Yeah, the scenarios are they make you think.
Yep. Donnie and Donna can both tell you that I'm kind of big on the critical thinking thing.
Man, is she? I hate scenarios. That's why she makes me do them. That's
But
cool.
Donnie, we all know you never think anyway.
Oh, what, man? That's not true. Checking to.
All right, so before we end tonight's lecture review and scenarios, reminder, I need everyone to email me, and I will send out my email in the group chat again. From the chest up, boys, from the chest up, passport quality photo, and reminder, fully clothed and looking nice in passport photos, for your ID badges.
So I was told you can get that done at Walgreens. I was gonna try and.
Yeah, you can get that done at Walgreens, or you can do it yourself with a family member and a cell phone.
I got you.
Does it have to be like a certain aspect ratio or something? Or do y'all do that?
In medical terms, from the nipple line up. Fully clothed, Donnie.
So just a portrait photo is basically it.
Yeah, just a businessy portrait photo.
All right, I got it.
Fully clothed, Donnie.
It will be. I'll make sure I wear something professional.
Okay, thanks.
It'll be good.
All right.
I mean, if you're not wearing pants, buddy, as long as the camera doesn't show that, it is what it is.
Bring out the GIMP.
Damn it, Robbie. You and Cole can take these pictures of each other however you want, as long as I get a passport quality photo. And that I'm not checking my inbox.
So Donnie, that means we can spoon from the nipple line up.
No, from
Bet, Cole. It's a deal.
All right. So what are you guys thinking about tonight? You're awfully quiet all of a sudden.
I just was reading over your checklist here, and I think I've kind of noticed that maybe because there really isn't time in our 3-minute play scenarios we're doing, but I don't think any of us really did much reassessing.
Well, there in the beginning, you guys were crashing your patients faster than you could reassess them. And I'm just speaking bluntly here. Y'all were killing them too fast to reassess. But,
Can I add to that? Because I was in for a little bit earlier and I was listening to some of it.
Yeah, go ahead.
Just keep in mind too, you guys aren't in basic school. So it's not so much about learning your assessments as you did then, where you just had to spit out the things you were going to do. Now you're kind of taking on a team lead role. You're not really the paramedic, but there'll be situations where you are the buck stops with you. You're the top person there. So yes, you know that you got to get through your primary before you do your assessment, your history, for example. But you can start to do these assessments from a team lead standpoint, where you can say, I'm going to have my partner get a sample history while I'm focusing on the primary. That is a very good way of doing things. When you get to boot camp, we're going to start partnering you guys off with some of the basic students. so that you can do that real world where you can direct your EMT to get a history. And then so you're not really the one trying to regurgitate the questions. We expect you to know that already. You're the one that's going to take the answers to those questions and figure out what you're going to do with it. So you can kind of see how your assessment becomes more real world, especially at the advanced level, where you're doing things concurrently. You can have your partner do a whole bunch of crap while you focus on the advanced stuff and then looking at it overall. If you look at it that way when you're doing it in class, for example, when Mike was going over one part of it, he was trying to get past airway, and you were doing everything you were supposed to do there, but from a team lead standpoint, you do have a partner. You can direct your partner to kind of get some things you haven't gotten to yet. Just something to keep in mind. It's a different mindset than what it was in basic. And some of y'all that just came out of the basic program, it may be a little difficult for you to switch into that gear. That's all.
Just remember to say please.
Right now, it's a lot of critical thinking and learning that your job is not just to take the vitals that somebody told you to take. It's about, okay, I'm in charge of this situation. I have to keep the peace with the grandmother who keeps yanking at my arm while I'm trying to work on her kid, or her grandkid. I have all these roles. I have to delegate. I have to manage it. And I have to critically think through very quickly what's important, what's not important, and what should not ever even cross our mind. Do you understand what I'm saying? It's not just about the treatments now and the assessments. It's about how to manage it.
I understand.
Go ahead, Cole.
No, I was just I'm just listening to it. I was trying to, like, I don't know, come up with a good way to be able to think about all this at the same time while I'm also doing an assessment or something if need be. Because I mean, even still as a primary provider, like just going through the skills and stuff like that, when we do redo our assessments, we're still the ones doing the assessment. It's just,
No, you're not. You're standing back, you're assessing the situation while you're saying, hey, you, firefighter number 1, I need a set of vitals. You, firefighter number 2, I need a IV, oxygen, whatnot. Is that done? Okay, what do you have for the vitals? Tell me. Okay, I see the vitals. I see that the blood pressure is really low, heart rate's really high. Oh, sepsis. You know what? Let's go ahead and get second bag of fluid going. And then you're reassessing. You're working with your brain now, as opposed to being the one working with your hands and getting this stuff done. You are delegating, you are managing. And sometimes you're saying, everybody stop. I need to take a look at the situation and regroup. But you're doing it fast. Am I wrong?
no.
Rob?
No, you're absolutely right. I was going to say there are some things we already know or expect you to know because you're a basic. You had to be a basic to get into the class. Knowing what your sample history is, we expect you to know that. So I don't really need you, or not me, but your instructor, your evaluators really don't need you to necessarily regurgitate this like you did in EMT basic. It's more or less you need to know that that needs to be done. So you can say, I'm going to have my partner get a sample history. What is it? And if they want to hear it, they'll say, yeah, well, tell me what sample stands for. But you're typically above that. So you can say, I need this done. What is it? And then you're going to take that information, and you're kind of stepping more toward the clinician role where you're doing something with those numbers. Those vital signs mean something to you, as opposed to when you're in basic school, we just taught you to get them. And for those of you that were in the ARES basic, I taught you a little bit about what they meant, but we really didn't hit it too much because I didn't want to gloss everybody's eyes over. But at the advanced, and especially if you go to paramedic, it's more about what you know and what you can do with those numbers than it is about getting them.
Right. In tonight's class, the reason I want to do this is I want you guys thinking about everything changes now. you know. I want you guys talking through what you need to be doing, what we're going to be looking for. That way, we're going to be starting to hit some of the in-depth stuff, some of the trauma, the gastroenterology, neurology, cardiac, respiratory. Don't be thinking, okay, well, I get a set of vitals and I'm done. Be thinking, okay, what does this mean? What does that mean? How do I manage this? Okay? And we're not fussing at anybody by any means. When we say, nope, that's not right, think of it this way. We're trying to lead you down a path you can stay on for the rest of the semester. That makes sense?
Oh, totally.
Anybody have any concerns, complaints, or woo-hoos about tonight?
No, it's pretty good. Is Rob still here?
Yeah, he is. He's a little R.
I'm hiding in the corner.
Rob, I'm gonna need you to step out of the corner for a minute and answer a couple of questions for me.
I will do my best. What you got?
So first off, my license for Louisiana, it was told me it was sent back to me for reviews. When I got on it and looked at it, nothing, it doesn't tell me what to change. I didn't know everything looked right. Should I just go ahead and resubmit it? Because
Did they, when they sent it back to you, was there a message outside of the review that said anything about, let's see, the one that normally gets kicked back, the reason is because they want something from your current state saying that you're not wanted for murder, you're not, you know, stabbing your grandmothers in the chest when you work on them and that kind of thing.
Well, the questionnaire at the end of the application, all those questions are no. I mean, I don't see where it's telling me that I need to change.
Yeah, no, it's just, I know, like, for example, and Joey, I don't know if you're in class, but you'll know because this has been the bane of your existence for a year. If you are a state certified EMT anywhere else, you have to get a letter from that state that just says you're in good standing with them. That's all. And it can be an unofficial thing. Come from somebody at the state office, and I can help you with that off the record. I can probably do it all for you. I'll work on that. If I need you for anything, especially with you being out of town, I'll let you know.
Okay, in the meantime, should I just go ahead and try and resubmit this application?
No, not yet, because if they need that and you resubmit it, they're just going to kick it back again, and it just creates extra work for yourself and them. It won't take me but a couple of days to get what I need from Alabama, and then we can resubmit it with that at the same time, and they'll get you at that point.
Okay.
Mine back like 5 or 6 times before they processed it. Don't worry.
Yeah, I ain't even, like, they kicked back Joey doesn't belong to another state. He was in our EMT out of a class we did in Mississippi, and he never got a state cert, and we went back and forth with them for a year before they finally realized that not everybody gets a state cert in every state unless they apply separately. Then they finally did it. They did what we needed, but it took a long time and it took a lot of back and forth.
I got you. So it's just not as easy as I figured.
No, it is. It's just they, if you're already a state EMT somewhere else, they just want to get, it's not even an official letter or a form. It's just something in writing from the state saying, hey, yeah, we're not trying to arrest him for anything. He's an EMT in good standing. That's all. It's just something to back up what you put in the questionnaire.
Fair enough. Now,
but I will work on that for you so that that's not extra work on your part.
Before I forget, tonight's code is 0420.
doesn't it have to be 6 digits?
No, it's whatever the instructor makes it. It's fine. It's just as long as I know what it is. That way I can search it.
Okay.
Some people are having a problem putting in their attendance. If it kicks you back or if it just sits there trying to load and it doesn't do anything, just email it to me. Email me the information you would normally put in that attendance form. Just as a plain text email will be fine. That way I've still got it in writing if the website's not working.
And I,
What was the code again?
if you're,
0420. It's in your chat.
yeah, and I get an email each night that we have class of who is in the class, how long they stayed, what time they started, and what time they left.
Cool.
So, anybody got anything else? Donna?
Nope.
Donnie?
All good here.
All right.
I got one more. How will we be utilizing the Navigate program?
Oh, have you not watched the video from when we did that?
No, I didn't.
Okay.
In his defense, he's been saving lives in Alaska the last few weeks or longer. So it's been kind of hard to get into class.
I understand that one. Oh, just so you know though, I did go back and review where everybody's at with Canvas. I have 4 people who have not taken anything beyond quiz chapter 3 or 5. And everyone else, except for 2, have not gone beyond chapter 13. 2 are completely caught up.
Yeah, I might have to do a lot of work on that. I know I'm behind.
Yeah, you're fine though. Everybody is. All right, so I'm just gonna go back to the basic. Hold on.
So I put my code in, right? That's in there, and I think I've got the course listed.
Okay.
But apart from that, I'm not sure.
All right. My computer is froze up. Let me see what's going on. Ah. Okay. So navigate for the screen that you can see, thank goodness. Is actually chapter 18. You've got your textbook on there. You have your audiobook. You have lecture outlines so that if you want to take notes and keep up with the lectures, you can. These skill drills talk about the skills from each chapter you'll be doing during boot camp. And then I add in extra things from the anatomy labs and little memory aids for assessment and body parts and whatnot on here, like the heart lab. I really wish this wasn't froze up, but we can see how much time you spend studying. We can see pretty much everything you do on here.
I don't know, mine looks a little bit different than that. I mean, I've got the chapters listed, and some of them are actually missing, like 15's not showing up.
Yeah, because 15 was a review of CPR, and you just did your CPR at the beginning. And I figured out how to fix it, so here you go. I had the pin.
Okay.
So when you click on it, I'm just going to start with EMS systems because I haven't messed with that one and ruined it. You have your ebook and you have your audiobook, your flashcards that have everything in the chapter that it will quiz you on. All of your PowerPoints are in here that I have not marked all over. You get a nice fresh copy of your own without my writing all over them. Your outlines. When you get to the end of all the chapters, hold on, I have to move everything around to scroll on this one. Okay, stay. Good one. Sorry, guys. When you get to the end, you'll have everything that you're going to need for Skills Week will be added in here. If there's anything you have to bring. You have your list of possible ways to get extra credit. If you write a patient care report based on one of the scenarios we do, after lecture each week, or any of the ones we do during like tonight, you get extra credit.
Okay.
Just a patient care report, you know, like this last one, how you found patient's age, how you found them, what you did, just like you do on the truck, only a paper format. And the paper will be in there. I thought it already was, it may just not be showing. Going back to respiratory, since I know I didn't do that one, or I know I did put stuff in there that you guys haven't been tortured with. Not showing. What on earth? Well, oh, because I'm in the wrong chapter, duh. You've got, for example, your respiratory lab. Pretty much every possible study tool I can find for you guys to help you pass and to help you learn all this stuff, I'm putting in here for you. Along with the stuff that already came with it. You'll have your FISDAP access to study or to schedule your clinicals and to document all your skills you do during boot camp for the state and for National Registry. You will have your audiobook, lectures, everything that can help you guys.
Okay, I don't know if this is a question for you or Rob, but I know my recertification is coming up at the end of the month. When do we get that paperwork or the certificate saying that we can go ahead and recertify?
What do you mean?
For my current EMT license, because March 31st is my recertification date.
Yeah. So I'm gonna put together a it's gonna look like a completion certificate, but it's just gonna be an hours tracker for what you've done so far. And what you'll do is you'll upload that into the NREMT, and then just apply the hours to your NCCP hours to do your research.
Okay.
More hours we can get you in the classes you need.
Yeah, it's you've already done enough to complete your research. Besides, when you're enrolled in the program, they waive a lot of your they do it differently up there. When they find out you're in school, your school counts as your refresher. So you'll document it like normal. I'm going to give you a certificate that gives them, if they try to audit you, that certificate that you upload into the site when you do your refresher setup will suffice. They won't bother you. They'll see that and be like, oh, okay, he's in the EMT student. Cool, next person.
Okay, I think I just need to figure out how to go on that app and do all that.
Oh, I can.
It's on the NRA website. Do you know how to log? Do you have your login info?
I've got the app on my phone.
I do.
I don't know the app.
I can send you pictures because I just did mine and got it back. Like I submitted this morning and got it back like 3 hours later.
That'd be sweet.
It is.
So okay, so I'll work on getting you the certificate to upload, and then Krista can show you how it's done because I haven't done it from an app. I don't know. I always just go to the website.
Oh, old people on their website.
It's better than saying newspaper. I'm gonna mail it in.
That's true.
Defense, he's probably one of the most technically savvy people I've known.
Yeah, he is. He's pretty good.
Don't say that too loud. People want me to fix their computers.
Well, I already know, Rob.
Waiting on.
15 years.
Yeah, I'm the least technical person you will ever meet.
Well, there you go, Rob. There's you some business.
She's on the team. What are you talking about?
What you're saying is she gets a discount.
Well, I mean, she's a big reason why we're getting through everything. So absolutely.
Fair enough.
Nobody shoot the messenger, but it was really throwing me off tonight because Cole and Donnie sound so much alike.
Me and Donnie do not sound anything alike. Now, we've known each other a while, and I like to pick with him, but...
That's a
What, Donnie?
nothing. Cole, I love you, man.
See, they sound exactly alike.
I guess it's like twins the first time you see them.
Maybe.
Yeah, I'd like to see somebody call us twins.
I've
No,
never,
I just where you sound the same or you look the same until they get to know you, and then they see how different you really are.
Well, you meet us in person and you'll know.
We don't even look the same.
That's what I'm saying, Donnie.
Yeah. Not even, we
You
don't
got-
resemble.
Oh, y'all don't understand analogies at all. I got it. That's fine. That's fine. It's not this kind of class. So
Well, I'm sorry. Are you talking about the twins with Arnold Schwarzenegger and Danny DeVito?
okay.
There's a
that-
movie called
No,
Twins.
you're talking
y'all
about,
are kind of Cole's kind of closer to Schwarzenegger. You're closer to Danny. Sorry.
Man, I'm not that short, and
I
I'm not that
now
white, man.
cigar.
Some hating going on over here.
Hey, I think this is their third, Robbie.
Donnie, don't worry. They're both rich.
Hey, that is true. They
What?
both got money.
Go back to spooning.
Cole, I will spoon with you. If that's what you want, I will spoon with you.
Robbie.
Wouldn't be the first.
Hey, are we? The recording's off, right?
No.